Safe environment. Information on children's rights and protection. In this video, we will help you to remember what feeling safe means and understand or identify the signs of abuse for children experiencing violence. Let's go back to your childhood. Imagine a place or situation where you could feel safe. Where is this place? Whom are you with? What does it feel like? What is the sense in your body? What can you see? What can you hear? As you may see from your answers to these questions, feeling safe means much more than not anticipating harm or hurt or being protected from any danger or risk. Feeling safe may mean for someone being themselves, experiencing inner calm and peace, being focused on the present moment, savoring, being creative and playful, experiencing gratitude or having the feeling that they want to stay exactly where they are. For many people, the sense of safety relates to their home and with being with beloved people. Especially for children, safety is highly linked to their parents and their family. The attachment theory, one of the most groundbreaking and influential psychological theories of the 20th century, supports that parents should provide a safe space in which children can get comfort and relief when feeling afraid or threatened. Children that feel that their parents are emotionally available tend to reach out to them when feeling stressed, while those who perceive them as unresponsive are less likely to seek help when in need. Better quality of this parental-children emotional bond is associated with higher self-image and the ability to understand and to regulate feelings, more stable relationships with significant others, and better mental health and well-being. This emotional bond between the children and their parents is essential for children's development and survival. This means that parents are very important figures in the children's life. Not only they have to cover their basic needs like food, shelter, medical care, and access to education, but also to create a supportive space in which children may feel safe, develop, explore themselves and the environment, and reach their full potential. When children go through a stressful situation, they focus most on the threat and the problem they are experiencing, and they tend to be hyper-vigilant for the next danger to protect themselves. This constant vigilance and anxiety do not allow children to invest their full potential into important developmental achievements and foster the attitude that the world is not a safe place to be. Despite the campaigns and the social discourse about the importance of growing up in a safe environment, the percentage of child abuse, maltreatment, or neglect is still very high. According to the World Health Organization, nearly 3 in 4 children, or 300 million children, aged from 2 to 4 years, regularly suffer physical punishment or psychological violence at the hands of parents and caregivers. If you are a parent or if you are someone working with children, it is crucial to keep an eye on any possible signs of abuse, which may be at different forms. Also, it's important to note that neglect is also considered as a kind of abuse. Abuse may be physical, emotional, or sexual. Physical abuse is any corporal punishment like spanking, kicking, slapping, pinching, shoving, physical restraining, pulling by the hair, pushing, which may lead to intentional injuries or other kind of physical harm to the child. Emotional abuse includes verbal assault, criticism, rejection, disregard, devaluation, and may have detrimental effects on a child's self-esteem, self-image, and welfare. Sexual abuse may be any kind of sexual action, including a child, like caressing, touch of genitals, intercourse, and production or exposure to pornography. Last but not least, neglect takes place when parents fail to cover their children's basic needs and provide supervision and emotional safety. The first step in helping abused or neglected children is learning to recognize the signs of child abuse and neglect. General signs that may point out to all aforementioned types of abuse are nervousness, hyperactivity, aggression, anger outbursts, mood swings, disruptive behavior, depressive symptoms, withdrawal, passivity, shyness, avoidance of intimacy and physical proximity, regression to previous developmental stages like bedwetting, unexplained physical symptoms like nausea, headaches, changing eating habits, or sleeping patterns, a decrease in interest for school, friends, or other activities that children used to enjoy, indications of self-injurious behavior like cutting or, in more extreme cases, attempt to commit suicide. In children of older age, the use of drugs, alcohol, and delinquent behavior may also be a sign. Physical abuse signs. Some signs that may refer to physical abuse are body marks like bruises, wounds, bite marks, scalds, fractured bones, cuts, and swelling that do not have any clear explanation, or injuries that cannot be attributed to the cause presented by the child or an adult. Head injuries in younger children may also be indicated by vomiting, seizures, exaggerated sleepiness, breathing problems, and many hospital visits. The fear of sudden movements, inappropriate clothes to hide marks like t-shirts with long sleeves in the summer, the repeated absence from school, and the excessive fear of punishment may show that a child is suffering from abuse. Sexual abuse signs. The signs that may indicate sexual abuse are improper sexual behavior to other children or adults, like rubbing of private parts on others' body, placing objects on their own genitalia or anus, looking others' private parts, or flashing their own, blood in the underwear, the bed sheets or other clothes, signs of injury or pain in the genitalia, mood or anus, pain when toileting, excreting, walking or sitting, pregnancy, sexually transmitted infections, the use of new words to describe private parts of the body that may be adult-like sometimes, the denial to take off clothes to take a bath, change diaper, or go to toilet, imitation of sexual behaviors or moves, especially when playing with toys or other people, talking, drawing, or dreaming about sexual issues, clues to evoke a discussion about sexual topics, experiencing of their body or themselves as bad or disgusting, referring to an elderly friend, denying to go to specific places, meet specific people or talk about a confidential secret, receiving gifts from someone without any obvious reason, fear of adults, asking constantly what will happen next, suffering from nightmares or being afraid of sleeping alone, and separation anxiety. Emotional abuse signs. Emotional abuse may be expressed as low self-esteem and self-confidence, small social circle or lack of friends, poor social skills, isolation from family, running away from school or home, and excessive aggression and passivity. In younger children, it could be expressed as lack of close relationship with their parents and inappropriate affection towards unfamiliar people, inappropriate childish or adult-like behavior, and difficulty in creating and preserving relationships. Beyond the category of a sign, the importance is to recognize a sign that may be indicative of a neglect. Those are presented in the next slide. Signs that may be indicative of neglect are poor personal hygiene, dirty or improper for the temperature clothes, great hunger, Poor self-help skills. Lack of supervision. Being left alone in home for many hours at a very young age. Not knowing where the parent is. Developmental delays and difficulties. Low language and social skills. Undertaking too many responsibilities and care of others. Poor living conditions at home. Stealing money or food. Untreated health problems and frequent injuries caused by a lack of supervision. Many absences from school or total lack of educational attainment and neglect of child's special needs. If you suspect that a parent may mistreat his or her child, there are some parental behavioral signs that are indicative of the need to act. Indifference for the child and their emotional and physical needs, constantly blaming the child or characterizing it with negative words such as useless, harsh discipline attitude, very high and unrealistic expectations regarding child's school or physical performance, limitation of the child's social circle, and expectation of child's constant attention and care. Some risk factors that may increase the possibility of child maltreatment behaviors are parental substance abuse, a history of parents' abuse, parents' physical or mental illness, financial difficulties, and family crises like divorce. Now that you know the signs, what can you do? It is important to ask for professional help right away. Also, reach out to your friends. It can be helpful to share the problem with people you trust. If you are a parent, you are going through a stressful situation and you feel that sometimes you may lose control with your children. You should also visit a professional in such a case. It is important not to respond with anger to your child. It is essential to build a relationship where children could feel safe to talk about anything they want, ask for information, or seek relief. Recognizing their needs, listening, and communicating with them from their first years are the best strategies to develop a meaningful relationship. To prevent abuse, parents should also educate their children about the notion of consent and teach them to say no. Children should know that they do not have to do anything that seems frightening or uncomfortable. Closing this session, I would like to thank you for watching and ask you to reflect on the following questions. Can anything in this world be safe? Or can danger be left out? Is it possible and effective for children to grow up in a bubble of overprotection and care? As you may have understood, this is neither realistic nor constructive. As many psychoanalysts have often stated, the first place of feeling safe is mother's womb. Being born and brought to this world entails setbacks, stress, and risk. So, after taking for granted that there is not this ideal of safety, what kind of safety are we talking about? Well, we are talking about the feeling that even if something bad happens, children will find support, care, and relief in the parental relationship and later in their social connections.